Hello, 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 loyal viewers to SHEM Ministries. Welcome to tonight's episode of SHEM 2. Well, first of all, what is SHEM Ministries? SHEM is a what? Souls, you and I, honoring Elohim's mandate. When you are a soul honoring the mandate of God, you will broadcast anywhere, anytime, any place that God will have you to be. So, all of that being said, I, Dr. Anna Shaw Devlin, this is my SHEM 2 night, a spiritual, healthy, enlightening mandate ministry. This is a special broadcast to compensate for the postponement on Tuesday night, which was our normal night. And tonight, I am broadcasting from my phone. So I have no tripod to hold my phone. So please, please, please forgive me. If there is some movement, this, that, and the other, we're going to multitask and do the best we can. But I need you to focus on the words coming out of my mouth and not what I look like or try to figure out where I'm at. But anyway, long story short, God sent me on an assignment. And my assignment, I wasn't, sometimes we think things really through, like I would have brought the tripod, but I didn't. So anyway, moving forward, tonight's message is actually going to, is part 2 of the message that we broadcast a couple of weeks ago. Okay. And we talked about heart murmurs and we talked about the valves in our heart. And the message was value your valves. Who's listening? And I did, I think, a pretty good job on taking something that could technically be difficult and making it as simple as possible, teaching you about the valves in our heart and the blood flow through the heart and why our valves are so important. And at the end of the lecture, we talked about the 2 main valves that, if they were damaged, they were the 2 that would cause you the most problems. And that was the aortic valve, and that was the mitral valve. And we talked about aortic regurgitation, which is kind of like a hiccup of blood going through the valve where it didn't go through properly, and the blood kind of backed up a little bit, and the blood flow may have regurgitated in a different direction, and that wasn't healthy. It could cause some issues. And we talked about stenosis, where the valve itself was, the area or the opening was narrow, and that could cause problems, decreasing blood flow, because remember, red blood cells carry oxygen. And if you have no oxygen getting where it needs to be, you can have tissue damage and chest pain and all of that, right? So we talked about that. So tonight, moving forward, I wanted to talk about valvular heart disease. And I wanted to talk about the most common is degenerative valvular heart disease versus rheumatic heart disease. So do know that a person is not as common today as it used to be because of vaccinations. But if a person had rheumatic fever, especially as a child, it would affect the bacteria itself, um, would affect the valves in the heart, and you can have damage to your heart valves because of rheumatic fever, and that is the rheumatic heart disease, rheumatic valvular heart disease. But tonight I wanted to focus on degenerative valvular heart disease, and I am going to give you information. And this is, you never know when you need to know this, because if someone tells you you have a heart murmur, these are some things that I want you to understand increases your risk. So, okay, first of all, let's say it like this. Having a heart murmur can be totally innocent, right? But if you already have a murmur, which lets you know that there's a potential compromise to the blood flow to the heart, that innocent murmur can turn into valvular heart disease when you have certain risk factors. And that is the significance of the lecture tonight, to take the information that I gave you 2 weeks ago and understand why it's so important to know this stuff and be on top of it just in case. That's why you say make sure someone is listening to the valves in your heart, so that if what was once innocent becomes problematic. So let's pause a moment, have a brief word of prayer, and move forward in our lecture. Dear Heavenly Father, we give you all the honor, the glory, the thanks, and the praise. Father, we thank you for this day, for this is the day that thou art made. And I am exceedingly glad in it. And I pray that each viewer on tonight is exceedingly glad in it, that they were given another chance in the land of the living to make their wrongs right. You have the opportunity tonight, today, this evening, that if you wrong somebody, or things seen and unseen, don't even ask for forgiveness. Sincere forgiveness. That's right, whether they deserve it or not. Because I'm going to tell you, there's some people that push some buttons and deserve whatever they got. However, as a child of God, we ask for forgiveness because there are sins of omission and commission that we don't even realize we did, that we need forgiveness for. Okay? So, tit for tat. I did something I shouldn't have done. Lord, please forgive me. So, I'm going to ask forgiveness for something that I don't even realize, or, and vice versa. So, Father, we thank you. So, now, let's start with, and I'm trying with this, my hand gonna be broke by the end of the night, but I'll be all right. So, valvular heart disease, like I said, heart murmurs are a precursor to valvular heart disease. It doesn't necessarily have to be a disease, because a murmur is just a symptom in a sense. It doesn't have to be diseased. All right. So we're going to talk about when it does become disease. Degenerative valvular heart disease. And I already mentioned that there is the non-degenerative valvular heart disease, which was the rheumatic heart disease. Now, let me tell you, I want to reference a research study that was done on an elderly population in southern China. And the reason, and this was done in July 2015, they did it for about 2 years, July 2015 through August 2017. And the reason I chose this research study is because they were in southern China. Their diet, I hate to say it, it's probably a lot healthier than ours. So if these people had degenerative valvular heart disease, we in America who fry everything, who knows? Okay. So this research study, like I said, was 2 years from 15 to 17. There were 3,538 participants, and they were at least or older than 65 years old. So when something is degenerative, it usually says over time it develops. It is degenerative. It develops over time. And when something is degenerative, the most common etiology for prevalence is advancing age. So the risk increases as you age. Okay. Now, out of the 3,538 subjects, 1,307, which is 36.9%, ended up being diagnosed with degenerative valvular heart disease. Okay. So I also want to give you a little bit of statistics about the rheumatic heart disease. Now, of course, you know that we have developed countries and we have undeveloped or developing countries. So, a developing country would be like Africa or Turkey. And I'm using those two countries because I want to give you the statistics that were presented in this research about the difference between the two, the percentages, because I want you to understand how blessed we are to be in a developed country. Stop taking it for granted and utilize the resources that God has given you. Now, in these developing countries such as Africa, 72% of the population had non degenerative valvular heart disease, which means their heart disease was rheumatic heart disease. Okay. And in that was 72% in Africa. And then in Turkey, now, you know, Africa is a big continent. Turkey had 46%. Okay. So just understand that this research was done in southern China. And if it based on southern China diet, all of that stuff, can you only imagine the United States? And I think one of the reasons it's easier to do a controlled environment, such as a communist nation, you know, where they don't have the freedom that we have to go and come and this, that, and the other. It's easier to do research when you know the participants, where you can, you know, have a little more control. Okay. So what I'm trying to say is I'm not too sure how well we would do in the United States, because research is only as good if the study can be completed. So many people drop out, you know, 2 year span. I don't know. So we take the information that they afforded us and apply it to our lives. Um, so as I said, degenerative is the most common etiology, increased prevalence was advancing age. But it differed in in your living arrangements, where you lived at. It differed in your educational level and your occupation. Now, do you want me to tell you my speculation on why there was a difference? The more you make, your education, your occupation affords you to live in a better place. If you live in a better place and you have more money, can you not afford to eat better? Can you not afford to have access to healthier lifestyle? So people who are poor in a rural area, who have no parks, recreation, can't afford to gym memberships and all of that stuff, think about it. The risk, there's a variation in the prevalence. But one thing I will say, it doesn't matter when it comes to age. Your risk increases as you age. There was a twofold increased risk for every 10 years of age. For example, 65 to 75, it increased twofold. So, for example, if it was 30, then it would be 60, right? Twofold. Now, there I'm going to go through some risk factors, and I also want you to apply these risk factors I'm going to discuss in your life, and I'm going to explain some of them. So, CRP. Remember that. An elevated CRP. And I'm going to tell you what that means. CRP is a C reactive protein. It's a protein. Oh boy. CRP protein. What in the world? Why are you wanting me to know about that? Well, let me explain CRP to you. And like I said, I'm trying to hold my phone and flip my paper over and all of that. Now, what I want you to understand about CRP, please forgive me, it is C reactive protein. It's a protein that your liver, it's a protein that your liver makes. Okay. The significance of CRP, all it means is if it's elevated, there's inflammation in my body. Inflammation can be acute, sudden, or temporary, inside our body or outside our body. For example, due to an injury or inflammation or infection. For example, you can cut yourself or get a wound like cellulitis and end up with an elevated CRP. So it's a very reflexive, but it's a good marker of knowing if there's inflammation in your body. So it's one of those tests that are used to say, um, I'm trying to tell you in a nice. It's one of those tests that you can do to kind of point you in the right direction, but you can't base a diagnosis or anything on it. And basically, you can use the CRP level to help know, is the inflammation getting better? Is it increasing or decreasing? For example, people who have ulcerative colitis or Crohn's disease or rheumatoid arthritis or any type of autoimmune disorder, they would be people that you would follow CRP levels on, just to kind of get an idea if they're having an exacerbation of their illness. but it's not a test result that would actually diagnose something. Okay. So it's a good biomarker to kind of give you an idea. Okay. But it's not, anyway, just understand that part. Okay. So injury or infection, blah, blah, blah. So they do look at CRP levels. So it's normal for our body to have a low CRP. And then if it spikes, it's just like, uh-oh, there's something going on. Especially if the person is running a fever and have an elevated white blood cell count. Well, what does all of this have to do with heart valves? Well, valves in our heart can be compromised over time from long-term inflammatory issues. So if you have an inflammatory disease in your body, it can affect your heart, and you can have degenerative valvular heart disease from prolonged inflammation. That's what degenerative is. It didn't happen overnight, it happened over time. So that's the reason why an elevated CRP has significance or importance in this situation. Okay? Now, the the second thing would be cholesterol. So, you have an elevated LDL cholesterol. LDL, what's that? That is the low density lipoprotein. So most people get your cholesterol checked, right? And your doctor breaks it down and they'll say your total cholesterol is good. Okay, that's good to know. Then they'll tell you what your triglycerides are, your HDL, high your HDLs, which is your happy good cholesterol, okay? And then they'll tell you what your LDL, which is the low density. So your high density, low density. So we would think that having a high HDL would be bad. But guess what? No. The higher your HDL is, the better it is for you, because the happy lipoproteins help to destroy the low bad proteins. How do you get your HDLs up? Exercise. Diet and exercise increases your happy cholesterol. Got it? All right. So while we're talking about the cholesterol, because cholesterol is significant, let me give you some information about that and why it is important to I got so much stuff written on my paper here. All right, so wait a minute. It's on the other page. Hold on. I'm sorry. It's over here. Uh-oh. We talked about the lipoproteins. So the total cholesterol should be, I had it, there used to be, okay, let me say this. A long time ago, they used to tell us that long as your total cholesterol was less than 200, it was okay. Well, guess what? Not anymore. Because as we learn and we research and we identify things, we know better, do better, know better. Okay? So the deal is now having a total cholesterol, I think it's 150 is our goal. Oh my gosh, where is it at? I don't want to tell you something. I got it written on here because this is, bear with me. Please forgive. Please forgive. That's sad. I can't find it. But anyway, it's not 200 anymore. Please, please, please know that. And it's I think it's 150, 152. Oh, I found it. Woo! Praise the Lord. Praise the Lord. So, and it's actually dyslipidemia, not hyperlipidemia. Dyslipidemia means your numbers are just poor, not proportionate to what they used to be, not just having an elevated total cholesterol. It is a issue where your HDLs may be low and your LDLs may be high. It's dyslipidemia. All right. So the total cholesterol, oh, greater than 240. Excuse me. But ideally, you want them a lot less than that. Yeah, less than 200, significantly less than 200. I apologize. I would love 150 if I were your provider. But it is total cholesterol greater than 240 is a real problem. With the goal of less than 200. Triglycerides greater than 150 is not good. And now remember, that's fasting. You cannot, and please, 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 don't lie about being fasting because it can cause you something, taking medication that you may not need. Okay? Don't lie about being fasting because the numbers are interpreted differently. Okay. So triglycerides greater than 150, LDL cholesterol greater than 160, and your HDL's less than 40. All right. Now, the other thing that increases your risk, having a diagnosis of coronary artery disease increases your risk of valvular heart disease. All right. Remember now, I'm giving you this information because I want you to be proactive. So, having a diagnosis of coronary artery disease, how do we get that diagnosis of coronary artery disease? Well, there are several things that can give you that diagnosis. And it is deemed present based on the following. If you have a history of angina pectoris, pectoris, angina, okay? Pectoralis is the heart muscle. Angina is the pain, having chest pain in your heart. So angina pectoralis is chest pain from heart disease. So if you have a diagnosis of angina, then you carry or have a history of a myocardial infarction, which is a heart attack, MI, you have a diagnosis of coronary artery disease. So people get upset, and I've had many patients get upset because ain't nobody ever said I had heart disease. Where in the devil that mess come from? Who put that in my record? I'm telling you, these are how you get a diagnosis of CAD, coronary artery disease. If you've ever had chest pain, angina, or a heart attack, even a light heart attack or a slight heart attack, if they put CAD in your record, that's because of those things. If you've ever had a positive stress test where you get on the treadmill and all of that, or they do a cardiolite stress test, you have a diagnosis of CAD. If you've ever had angiography, what is angiography? That is a nuclear medicine test where they go in and look at the arteries. They can do a CT angio, cardiothoracic angiography of your heart. And if there's evidence of narrowing or blockage on that, you have a diagnosis of CAD. So stop cutting up. If you've ever had a coronary intervention done, such as a stent put in your heart or a balloon angioplasty, the rotor-rooter where they go in and they dilate, they chisel away at the plaque buildup in your arteries, you carry a diagnosis of coronary artery disease. If you've ever had bypass surgery to your heart, coronary artery bypass graft, or the presence of significant, okay, Q waves on a surface electrocardiogram. What in the devil you talking about, Dr. Devlin? Well, guess what? Remember when we did the talk on EKGs and I told you that they can look at your EKG and tell that you've had a heart attack before? And there was something on the EKG called a Q wave. You may not remember that. But if you have a significant Q wave that shows up on an EKG, where they put all those electrodes on your body, they can put in your record coronary artery disease. You don't have to have a heart cath. You don't have to have had bypass surgery. You do not have to have XYZ. I'm telling you all the reasons you could end up with a diagnosis of coronary artery disease. Now, the other things that increase your risk, okay, we've already talked about, let me get back, flip back to, my page. So coronary artery disease, smoking. Smoking increases your risk for degenerative valvular heart disease over time. You want me to tell you why? All right, let me tell you why. I'm having to keep flipping my paper back and forth. So, smoking, it is actually what is in cigarettes. What is in cigarettes that the tar and the nicotine. And guess what else? Well, the tar and the nicotine itself, what it does, it causes inflammation in your valves. Yes. Did you not know that? Are you telling me that I can smoke a cigarette and the byproduct of that smoke will line the arteries in my heart, not just my lungs, and I could end up with heart disease over time from smoking? Yes, yes, you can. And I was trying to find where I had on here more details about the actual cigarette smoke itself. Oh, smoking, the toxins in the cigarette that you breathe in causes irritation and injury to the blood vessels in your heart. Okay, there it is. I got it. Now let's move on. High blood pressure. Of course, we know hypertension can cause heart disease because it damages the vessels itself. All right. Pressure over time weakens the vessels and you end up with heart disease. And that is a blood pressure greater than 140 over 90, okay, significant, or history, so I'm not going to beat up hypertension tonight because we've done that many times. Now, if hypertension is the only thing you have, 140 over 90 might be a goal. But if you have coronary artery disease, diabetes, you smoke, all of that, the goal blood pressure may be lower for you. There's recommendations if you're diabetic for it to be even less. Okay, so let me say that because there's some people stuck on numbers, but I want you to understand why numbers change. It depends on all those other factors. Now, There is elevated or decreased red blood cells in the body, increased platelets, high uric acid levels, and having a stroke are things that are also likely to increase your factor of having valvular heart disease, degenerative valvular heart disease. And I'm going to throw a few things out there that I think you need to know about. It's for such as uric acid levels. Why should we worry about uric acid levels? Okay. Well, let me tell you about uric acid levels. First of all, uric acid, people who know about uric acid are the people who have gout, because most gout is associated with high uric acid. How do you get uric acid? Well, let me tell you. Uric acid is actually the end product of purine metabolism. What's purines? Oh boy, we're full of stuff tonight. Purines are things in our diet that's in the food that we eat. So remember, remember I said you are what you eat. Everything you put in your mouth, there's a byproduct of what you put in your mouth. I'm not telling you, scaring you to eat, but I'm telling you everything we eat should be in moderation. And we should be mindful of how much we eat of something, and also mindful of the fact that if the doctor says you have kidney stones, for example, you need to first of all find out what kind of kidney stones you have. And more than 90% of people who have kidney stones are uric acid stones. You know why? Because uric acid is, like I said, the byproduct of purines. Purines can be sugary foods and beverages such as soda, especially anything. Now, y'all hear me talk about high fructose corn syrup. Anything that has high fructose corn syrup can increase purines or high in purines. And it doesn't become an issue to you until you start having kidney stones or gout. And then that's when people learn about purines in their diet. Now, if you talk to anybody that had kidney stones and gout, they're going to tell you it don't feel good. So I'm trying to tell you, before you end up, all things in moderation. And always drink your H2O, your water. Then we talk about what percentage of our body was water, and the reason why God created us the way he created us, because he knew that we needed the water. Okay. So, the other thing with purines is seafood. So I guess what I'm trying to say to you, if you don't want something to have to be taken away from you, or you can't enjoy something, eat it now in moderation so that you don't end up with these issues. Seafood, scallops, anchovies, herring, which is a type of fish, are high in purines. Organ meats, such as liver and game meats, can be high in purines. Beer is high in purines. So if it's high in purines, when it breaks down, the byproduct is uric acid. That's the association. So avoid high purine diet and eat more whole foods, whole grains, this, that, and the other. And guess what else we should eat more of? Plant-based diet. Now, I do want to mention to you that there are certain foods that are, let me see, vegetables, which are known to be high in purines, that are actually healthy and will not increase your uric acid level. Let me say that again. There are vegetables known to be high in purines that will not increase your uric acid level, and they are, and I hope y'all taking notes. We talked about taking notes. They are peas, asparagus, and oatmeal. Peas, asparagus, and oatmeal. Now, low fat or no fat dairy is also low in purines. Protein based foods, and drinking plenty of water. So, with every meal, we're supposed to drink plenty of water. It aids in digestion and it lowers the uric acid concentration in our blood. Coffee and tea will not increase uric acid levels. In fact, coffee may help lower uric acid levels, but watch out for the caffeine and the side effects of palpitations. So basically, there's no win win. There is no, let me not say that. Everything we do should be in moderation, okay? There is controversy over certain things. Um, tart, unsweetened tart cherries help prevent hyperuricemia and gout flares. Cherries are good. I love cherries. But of course, if you're diabetic, moderation. Also, there's limited research suggests dietary supplements, vitamin C and folate treat and prevent high uric acid levels. Okay, why did I spend a lot of time on uric acid levels? First of all, some people have calcification in their heart valves that are associated with diet. And it's kind of like if you have an issue with one thing, you're at risk of having an issue with another. So a person who has a lot of kidney stones and, gallstones and all of that increases your potential for having um, buildup in other places in your body, blood vessels. Okay. All right. And let me also say this too for people who have increased inflammation in their body, like arthritis, gout, and arthritis. Whole foods, plant based diet decrease risk overall levels of inflammation and arthritis. Okay. That being said, now let's talk about, okay, so we talked about those things. Um, we talked about the heart disease. I want to talk to you about, oh, Lord, I got a lot of stuff here. We ain't gonna be able to cover all of this, but let me talk a little faster. So, valvular heart disease is a condition strongly associated with heart dysfunction in elderly population. Okay. There was also a European heart study that the etiology, which is the cause of valvular heart disease, was mostly degenerative. Okay. Present in 63% of population in developed countries. All right, we already talked pretty much about that. Let me flip the page. I'm trying to see is there anything significant that I wanted to talk to you about. And I think I pretty much covered it. Don't forget obesity. Um, Need to know things. Having a stroke, heart failure, BMI, um, your blood pressure, your waist and your hip circumference. Those are some things that increase your risk of coronary artery disease, but coronary artery disease increases your risk for valvular heart disease over time. So I get, you guys know one thing is associated with another. They're all tied together. I'm sorry, they are. And you say, well, ain't nobody never told me that. But guess what? That is linked to this. And if you don't know that's linked to this, then you may ignore something when in actuality, you don't need to ignore it. You need to know what you're at risk for, because something that is degenerative, you don't change. It wasn't acute. Okay. Um, so echocardiogram, ultrasound of the heart. The best echocardiogram, I'm just giving you facts now, okay, is a transthoracic echocardiogram. 3 views of the heart. It's a long and a short axis of 4 different views. Okay, just know TEE, transthoracic, TTE, excuse me, transthoracic echocardiogram is the best one to have if you want the best picture. Why? And it ain't cheap. Copay ain't cheap. So if you're gonna pay for one, how about get the best one? Okay. Because remember, I told you that that's one way of identifying the valves in your heart. Now, let me also say this. I ain't trying to be funny, trying to be picky. But if you tell me that my echocardiogram shows this, I want a second opinion. Not that for a second opinion having another echo done, but a second opinion of having another technician, licensed professional reading my echocardiogram. Because you have a sonographer, a technician doing the exam, but they're not the ones reading it. I want the doctor that has at least 10 years of experience to ensure quality in my reading. You get me? Okay, you want what you pay for, right? Okay, I ain't trying to be funny, but can I get somebody a second opinion? This is your life, one life to live. When it comes down to my life, I don't care if you get upset. Just because I asked for a second opinion. Because let me tell you what's going to happen. If that second opinion proves that the first person knew what they were saying, all it's going to do is pat you on the back and give you confidence. Don't get upset and don't get mad. It just gives you confidence. Okay? But you may have to break it down because people, they're human. They be getting all upset. All right, let's talk about degenerative characteristics. Now, this is the most significant thing that I need you to hear me say and remember. Degenerative valvular heart disease. The significance of the information is characteristics of how thick the valves are, the leaflets that open and close that allow blood to go through your heart are. Thick valves that are stiff. Think about when a person has arthritis. Are they not stiff? It's almost like saying, now think about this. Remember, I told you CRP, inflammation. So if CRPs are high, and that can indicate that I just got arthritis. If a person has arthritis, are their joints not stiff? So if I have an elevated CRP and the valves in my heart have a lot of inflammation and they stiff, it's kind of like saying my heart valves got arthritis. Ooh, Dr. D told me that my heart valves got arthritis because they stiff. Well, guess what? If that's what it takes for you to remember this lecture tonight, to God be the glory. Over time, all that inflammation, all that whatever, the cholesterol lining the blood vessels. So think about it like this. The cholesterol is in your blood. Does the blood not go through your heart? And as it's going through your heart, can it not build up in the leaflets of the valves? Yes. Right? Ding, ding, ding. Pictures in your mind. Hear the words coming out of my mouth because this is significant. You can prevent this. That's the thing about degenerative heart disease. It can be prevented by lifestyle changes. It increases as you age, 65 and older. Now, what happens is if those valves get stiff, they get restricted in their movement, their motion. So, severe valvular heart disease, severity of it's the measurement of the size of the arterial and mitral. So the movement, the restrictive movement, and how much ability or lack of blood flow is able to go through the valve is how it's a measurement of severity. And there is a number, but I'm not going to tell you this because you're not going to remember it and you're not going to just know mild, moderate, severe. If doc says severe, it's an issue. And if they say mild to moderate, you don't want it to progress from moderate to severe. Okay? Just get that in your head. Because the more severe it is, the less blood flow. All right. And of course, they'll do a 12 lead EKG and all of that. We talked about that. Also, know that in chronic kidney disease, increases your risk. Okay. And it's defined as a serum creatinine level greater than 2. Keep that in your head. BMI, we already talked about a long time ago. Obesity is having a BMI over 30. These are just risk factors, period. Okay, that I do want to refresh your memory of, and you keep these in mind. Next, let me see what I wanted to throw out there. What have we missed? We're getting toward the end. Let me tell you a little bit about a SED rate. I do want to tell you about that. So there's a CRP, C-reactive protein, and then there's also a SED rate, an ESR. It's an erythrocyte sedimentation rate. So erythrocytes are red blood cells. Remember when I said about having elevated red blood cells or, was a risk factor. So SED rates are associated with inflammation as well. So many times when a doctor, first of all, you got all this swelling and inflammation in your joints and this, that, and the other, and you've got degenerative changes to your joints, they're going to do a SED rate and a CRP. Okay. SED rate shows inflammation in the body, period. It's another test. So I guess what I'm trying to say, the more tests that point in one direction, like if you've got 10 people saying go north, are you going to go north? Or are you going to go south? You're going to go north. So if you got an elevated CRP and an elevated ESR SED rate, I think I might have some inflammation without a shadow of doubt. Okay, that it may not be just associated with, remember I told you an elevated CRP could be associated with infection, but your SED rate shows inflammation in the body. The erythrocytes, like I said, are red blood cells, and how they measure a SED rate, it is how fast the red blood cells sink to the bottom of the test tube. So you put the blood in there and you look at the red blood cells and see how long it takes for them to sink to the bottom. Normally they sink slow. But in inflammation, it makes the red blood cells sink together in clumps. They clump together. Like, help me. Don't leave me out here by myself. Because misery loves company. So them diseased, inflamed red blood cells, they trying to find somebody to go down with them. So they clump together. If I go down, you go down. So the two of them clump together and go down together. And the two of them together gonna sink faster. Elevated sed rate. Clumps are heavier, so they sink faster. Sed rate, like I said, helps diagnose disorders of inflammation, arthritis, gout, especially gouty arthritis. You can have gouty arthritis. All right. Now, let me go back and say this one thing about purines. People who have a lot of uric acid and purines, are told to avoid purines, alcoholic beverages, especially beer. The first thing I ask, do you drink beer? Is a twofold increased risk of high uric acid level in stones. Yep, with drinking beer. Now, I don't know about light beer, but drinking beer. Okay. Also, having a high uric acid level, um, and I know we already talked about this, but this is just something I forgot to say earlier. It inhibits the body's ability to process and eliminate uric acid. And that's how you end up making stones, and you get stones in your bladder. That's how you get kidney stones. It does. Because if you can't eliminate the uric acid, it just sits there and clumps together and makes stones. I just telling you. All right. Well, I think we said pretty much what we needed to say. I'm trying to see, is there anything else significant that I wanted to tell you? Oh, abdominal obesity. Having a large abdominal girth, your waist circumference. I wanted to give you some numbers because I think one time before we talked about this and I didn't have the numbers to give you. So, abdominal obesity is defined as a waist circumference greater than 88 centimeters for a female and 102 centimeters for a male. I forgot how many centimeters is in it. Oh, somebody help me. In an inch. Anyway, you can do the math. I can't do it right now. My head's kind of, I got trying to hold this thing and read at the same time. I will not take it for granted in the future. All right. So I think that may have been, the last thing. Oh, dum dum dum. I was gonna tell you about, let's break it down into the severity of the valvular disease. Okay. Because remember, I told you that the people who had the over 1,000 people in this research study that had the degenerative valvular heart disease. I did want to break it down and tell you are which ones were effective, the aortic versus the mitral. Because remember, I told you those were the two significant ones. So, number one, aortic regurgitation. Moderate or severe aortic regurgitation was the most frequent found degenerative vascular heart disease in this study, and it was 14.9%. Next was moderate to severe tricuspid regurgitation, 13.1%. Then there was, let's see, what came next? Then there was moderate to severe mitral regurgitation, 7.8%. And the last was aortic stenosis, which was 0.9%. Now, remember, I told you the left side of the heart was where there was the mitral and the aortic valves. So there was the blood flow that was coming from the lungs back into the heart, which was the mitral, and then there was the blood flow from the heart, the left ventricle, out to the rest of the body, which was the aortic valve. Okay. And so just get the fact that the aortic regurgitation was most significant. And that is one of the, well, both of them are problematic, but the aortic is the one that's sending blood out to the rest of the body. It's sending the oxygenated blood to the rest of the body. So you got these people with purple lips and blue lips, and easily they cyanotic. Uh, you know, just something to think about. They lack oxygen. They get winded easily. No one wants to live like that. And what if they have COPD from all the years of smoking, too? Wow. All right, guys. God bless each and every one of you. Thank you so very much for listening tonight. This is Dr. Anna Shaw Devlin. We did a discussion on Value Your Valves, Part 2. Who's listening to your heart murmur? The louder the heart murmur, the increased potential of there being a valvular disease, and the valvular disease increases as you age. So if you've been told all your life you had a heart murmur, and you 65 and older, and no one's listened, you better, excuse me, doc, tell me a little bit about, they told me I had a heart murmur. Do you hear it? Make them put the stethoscope on your chest and listen. Or not make them. But if you make that statement, how about they going to listen? They're going to listen. Okay? And they might be like, hey, how long has this been here? Hey, come in here and do an EKG on this person. Oh, they might schedule them with a cardiologist. But doc, it's been there for years. Well, I guess they never really listened for years. Or it could have acutely got worse. Remember I told you heart murmurs can be louder when you're anemic? There's certain conditions that we go through that can make our murmurs come and go, wax and wane. So keep those things in mind. All right. God bless each and every one. Pastor Devlin will be back on Sunday. We'll be with you guys on Sunday. But guess what? I will always be with you, heart, mind, and soul. And we ain't talking about no soul train either. Okay? We talking about dancing for the Lord. And oh, glory be to God. Praise God for all that he has done. Father, keep your people in perfect peace, whose mind is stayed on thee. To God be the glory. All right. We love each and every one of you. We'll see you next Tuesday. And don't just be blessed, but be a blessing to God's people. Adios, amigos. Hasta mañana. Merci beaucoup. Who do I sound like? I love him. God bless. Thank you. Have a good night.